Welcome everyone to another one of our annual Medicare 101 events. I'm Mike Hebron, the Chief Operating Officer here at Level Financial Advisors. And tonight we're going to delve into the basics of the Medicare system with our trusted ally, Tamme Nash of the Sable Agency. But before we get started, just a few ground rules about how things should work tonight. First, we want this to be interactive. So you'll notice a little Q&A button at the bottom of your screen. If you have questions along the way, feel free to pose them there and I'll find the appropriate time to jump in and interrupt Tamme and ask the question live if it's appropriate. Also, we'll be recording this presentation and providing a copy of the slides to all attendees. And we send that out on our YouTube channel. You'll get a link for that. And finally, if you'd like to have a more detailed discussion with Tamme about your specific Medicare questions, you can use our text line service and actually text the word Medicare to 716-727-5047, and we'll have Tamme follow up with you directly on your behalf. So before we get started with Tamme, let's do a quick disclosure here. Something we're required by our friends in the government to do. This presentation by Level Financial is intended for general information purposes only, and no portion of the presentation serves as a receipt of or as a substitute for personalized investment advice from Level or any other investment professional. Please see additional important disclosures at the end of this presentation, and a copy of our current written disclosure brochure can be found at levelfa.com. So now let me introduce our guest speaker tonight, Tamme Nash. Tamme is an insurance broker and co-owner at the Sable Insurance Agency. She's a licensed insurance benefits coordinator, and she's been working with the senior community for over 26 years. She has an associate's degree in business administration and management from Johnson & Wales University. The Sable Agency has been in the insurance business for the same amount of time, priding themselves in helping the senior population and disabled understand what to expect when becoming Medicare eligible. They educate clients on the process of becoming Medicare eligible and the differences in health and prescription plans available to them so they can make the best personal decision for themselves and their family. Through Sable, Tamme represents many insurance companies in the senior market to provide clients with a variety of choices that will fit their personal needs. So I'm going to turn the presentation over to Tamme. And Tamme, I need you to unmute. I think at this point, I did notice that on your thing, it's muted. So hopefully you can hit that little button up there and unmute yourself. And if not, I will come right over there and get you unmuted.
There we go. Am I good?
All right, we're ready to go. And over to you. Go ahead.
Thank you, Mike and Level Financial, for having me once again this evening and throughout the years. It's been always a pleasure to work with you and all your clients. So thank you, everybody, for joining us tonight. And we're just going to go over, I like to call this presentation actually what to expect when expecting Medicare. But we're going to go over some just general educational, fundamental Medicare information that I hope you find very helpful and, just get some good information from it tonight. So we're going to go over some just basic stuff. So first, what is Medicare? It's health insurance for entitled beneficiaries 65 and older, some people that are under 65 with certain disabilities. Individuals that have at any age are diagnosed with end-stage renal disease or diagnosed with ALS. The term CMS does stand for Centers for Medicare and Medicaid Services. So if you get any mail that has CMS dated or stamped at the top, you know that that is very important information. The next slide we're going to go over today is just the general enrollment periods at a glance for people that are either turning 65 newly or may have still been working and might be eligible for some special enrollment periods regarding Medicare. So initially, the initial enrollment period that you see at the top is called IEP, or like I said, initial enrollment period. That will take place 3 months before your 65th birthday. the month of, and 3 months after somebody's 65th birthday. So that is a special window of time where people can be very eagerly active to go online and sign up for Medicare very easily. Or they can call their local office, set up an appointment, or even do it on the phone to sign up for Medicare in that 7-month window of time. The next one is the general enrollment period. This is for individuals that may have missed that initial enrollment period, so they're past that 7 months. That is very unfortunate for many. It does happen. And that time frame where if people missed in their initial election period is every year between January 1st and March 31st, where you can sign up. Your Medicare coverage will begin the month after you sign up for Medicare, which is something that has just changed in 2023. So if you sign up in January during that general enrollment time, it'll start in February. If you sign up in February, it'll start in March, and then March, it'll start in April. Penalties, though, will most likely apply in this circumstance. And that would be a 10% penalty for every year that you missed or have went past your initial election period. And that 10% penalty stays on indefinitely. Once again, that time frame now when Medicare will start has changed since 2023. And I will also say that I have seen this year, due to COVID, a little bit of grace for some people that during COVID or snowstorms or all the things that have been crazy in the last few years for us, there has been some grace given against the penalties, but in most cases you would expect a penalty.
A quick question on that,
Okay.
real quick.
Yes.
The penalty is obviously then on the premium, right? So
Correct.
it's a 10% additional premium on what you would have normally paid.
Correct.
Okay, perfect. And is it another quick question. If you did not apply for Medicare for 2 years, is it 10% per year
Correct.
penalty? Okay, so
Yes.
in other words, if somebody went 5 years and said, "Oh, geez, I forgot
Mhm.
to register," that's 5 years worth of 10% penalties, right?
Correct.
Okay, good. Thank
Right.
you.
I've had instances, certain governmental agencies, not to get into specifics, because it does depend. Every case is very different. But I've had some people that with governmental agencies that at the time when they were Medicare eligible, they didn't actually not have to take Medicare, but they had great insurance. And if those premiums have went up over the years, I had one individual come to me after being 10 years past, and he was very interested maybe in going into some of these lower premium advantage plans, which we'll talk about today too. But when we looked at him jumping into Medicare after 10 years, it would have over exceeded for him to do Medicare against his premium that he was already paying. So it made no sense. So that is true, Mike. It would be a 10% penalty on that premium that you're assessed in regards to Part B, which we're going to get to as the slides carry on. The next enrollment period at a glance is considered a special enrollment period. SEP is another term for it. That would be for individuals that are currently working and covered under a large employer group plan or covered by a working spouse. Large group is over what we consider 20 plus employees due to carrier rules. If somebody then is still working and then they want to retire and they didn't take Medicare initially, those individuals are safe. And that's where it's called a special enrollment period. So at that point, they can elect, they have a window of time from retirement that they can elect to take Part B within an 8-month period from when the retirement began or when your spouse has lost group coverage. The only thing about that is, yes, you have that window, but Medicare Part D, which is the drug plan, as soon as that group carrier plan ends, Part D gives you only 63 days from that retirement date to sign up for a drug plan, only if you are already enrolled in Part A. So most people, in my experience, they're, especially nowadays, people are more pre-planning. They're a little bit more aware. I think mailings, internet, TV makes people a little bit more aware of what's going on and rules. And most people would not wait longer than 63 days to sign up for a plan once retirement has happened, but there is a window that you are given. Okay. So how do we enroll in Medicare? So once again, if you're in your initial election period, that, first 7 months, you would go and apply online possibly. That's usually the easiest and seamless way to do it. That online information is right here on that screen. I do also tell people that, when people, if you go in and you Google Social Security, to do it that way, that can be a little bit of a slippery slope because there is a lot of non-governmental agencies that really kind of disguise themselves as Social Security. So you got to be careful with that. So if you go online, we want you to use this, this www.socialsecurity.gov site. You'll see that Social Security seal up at the top, left corner of the screen. And that is a very easy way to access forms, access online enrollments, even for Social Security income. You can use that site. You can also visit or call your local Social Security office in the county you're residing in to set up a phone call appointment, or you can actually set up an appointment in person now and go into your county office if that's, more helpful. When you call or set up that appointment, I will forewarn people, it can take 6 to 8 weeks to get that call. They will honor, though, if you're kind of getting down to the wire of your 7-month window ending, they will honor the date that you called in. So if your 7-month window is coming to a close and you call in the 7th month and your call is not for 2 more months, they will honor that. But once again, we don't want you to be waiting too long. But it is a very nice way. This national number that's here on the screen, I will tell you, they are high-end customer service people that are very seasoned. And I have nothing but very, very good feedback for people that call the national line to set up, a phone call appointment, to ask questions. They are fantastic and very, very helpful. So that number's on the screen as well. Why would somebody delay enrolling in Medicare Part A? So there is a lot more information, once again, around this, a little bit more helpful nowadays than back about 5 years ago. And this is because more people than ever are participating in high deductible HSA plans and contributing to the HSA account. If you are contributing to an HSA and you're still working for a large group employer and you do not plan on retiring in the near future, you will not want to enroll in Medicare Part A, since you are not allowed to participate in any other health insurance plan as well as contribute to an HSA plan. A little bit more information in regards to HSAs. If somebody continues to work and then now they're age 67 and now they're thinking about retirement, you must seize that HSA contribution once you've enrolled in Medicare Part A. But when you're thinking about it, you have to stop it 6 months prior to enrolling in Medicare. So let me say that again. If you, let's say you work 2 years past being new to Medicare, so now you're 67, you've been contributing all this time to the HSA, and now you see retirement in the horizon. You can see it. You are somebody that really has to pre-plan. You have to stop that contribution to that HSA 6 months prior to enrolling in Medicare. Any contributions made after enrollment are not tax deductible and may be subject to a tax penalty if you do not pre-plan. You may continue to spend down that existing HSA fund for any qualified medical expenses. So once you stop that contribution, let's say you have $10,000 in it it's not going to disappear. It's always still, there for you, and you can use it for qualified medical expenses continuing on. If enrolling in Medicare mid-year, your contribution limit will need to be reduced by the number of months out of the year you are enrolled in Medicare. Okay. More information about enrolling in Medicare, and this is a very, very important slide. Why, once again, would I delay enrolling in Medicare Part B? Why would somebody wait to do that? So if you will continue to work for your company after age 65, and you have health insurance through your employer, or if you're covered by your working spouse's employer, you will not have to enroll in Medicare Part B. This is as long as your employer group plan is larger than 20 employees. It must be over 20. That is the benchmark. Most Medicare eligibles will not want to pay an extra premium to Medicare Part B and to the group health insurance plan. Now, if you are still working, or if you're covered under your working spouse's employer group plan, and that employer has less than 20, it is advised to take Medicare Part B when eligible. This is due to group insurance carrier rules. If you do not take Part B when eligible, your group insurance carrier may not continue to pay your claims unless you take Medicare Parts A and Part B, which in this case would become your primary insurance and your group plan would be secondary. This is where people really, I had 2 clients like this today. They're still very happy with their job. They don't see retirement for a couple more years, and they are turning 65 in the next few months. When they came in to see me today, they're like, listen, like, I don't really want to take Medicare. I know it comes at a cost. And I said, well, okay, the first question I have to ask you is, how big is that employer? And it's not you can have 50 people in your group and only 10 take insurance. It's by the number filed with that carrier or with New York State. That's the bodies that they file, not by the people taking it, but the bodies that file. So both of these individuals, they're in very small businesses. One was like 18 people, one was 6. And I said, well, you call Social Security, they're going to say, you're fine, you're still working. As long as you can prove continuous coverage when you turn 65, you can waive B. But the carrier is going to say, oh, no, no, no. That's why they send out a lot of times these questionnaires as they approach people. They know people are turning 65. Because if your carrier knows you're a small business, think about it. If they know you're under 20 employees and they know Medicare can help pay those claims, they are going to want you to take Medicare. And then what would happen is Medicare would be primary. If somebody doesn't take Medicare within a allotted time frame of that 7 months, then they can kick back and say, hey, we're not going to pay these claims unless Medicare is going to pay first. So I've actually seen that. So with smaller businesses, that's when we really have to look at everything. Is your group insurance still, appropriate to keep? You're going to have Medicare now. We got to look at the cost of that. So with smaller businesses, you are encouraged to take Medicare. Now, if you're receiving Medicare due to a disability before the age of 65, the number above and the employees under even a spouse's group coverage and the rules of waiving Medicare Part B are different. It is recommended for beneficiaries to call Medicare before waiving Medicare Part B benefits if the disabled eligible is covered under a working spouse's large group employer coverage. The number is different than the 20 above. It's usually 100. So that's something where we go right to Medicare, we go to a carrier. If somebody is going to be getting Medicare early due to a disability, I just want you folks to know that is something that number of 20 is different for those disabled individuals.
So Tamme, quick question here, just to clarify. So at 65, everybody has to take A. They have to file for A, right?
Unless, okay, if they're still working and they have a large group plan and they still want to contribute to an HSA, large group being over 20, we would tell them not to take Part A.
Okay.
Everybody is granted A automatically as long as they've paid into FICA at least 10 years or 40 quarters. It's automatically, you can have it. But if you're still working and you have an HSA, we're going to tell somebody not to take A if they're going to continue on that HSA plan and be employed. Now, if somebody doesn't have an HSA and they just want to take Part A, it's not going to hurt them to take it. It doesn't cost them anything. And those individuals, we say definitely take A, even if you're still going to work, because when you take A right when you're eligible, and then in the future, when you go to retire, you're already in the system with Medicare, so it will speed the process up for getting Medicare quicker. So A is automatic, and we always would encourage somebody to take A at 65, even if they're still working. It's not going to hurt them at all. It would sit on the back fence if they're in a large group plan. But if they have an HSA, we're going to say to stay away from it. Once again, though, if somebody's in a small group under 20, they have to take A and B.
Gotcha.
Does that help?
Yep, absolutely. Thanks.
Okay. So this is the Medicare card. This card is everything. This is the card that when people are turning 65, I will say that if any of you are on tonight and you're close to 65, you're probably being inundated with mail and information. And this card, when it comes in for people around their 65th birthday, or even if they're just all of a sudden to sign on to take it, it comes in the most basic envelope ever. And a lot of people throw this card out, but this card is everything. So we always tell people, hey, if you're turning 65 and you've applied for that card, be forewarned that it's going to come in a 5x6 basic white envelope. That is the most important piece of mail you're going to get. I know people are being solicited, and a lot of times it's overwhelming, but this is one card you don't want to throw out. So this card will have your Medicare number. It used to be your social security numbers, but since with HIPAA and everything, since 2018, they took social security numbers off the cards, which is a wonderful thing. And now they have just specific basic letters and numbers for everybody that's applying for Medicare. And then it will give the dates that Part A went into effect and Part B. Okay. So Part A, what is Part A? Once again, Part A, I always tell my clients is basically the government. When you get the Medicare Part A benefits, there's no cost to it. I always tell people when you're turning 65 and you get A, I always say it's like your birthday present from the government saying, thank you so much for paying into FICA your whole life. We're now going to at least give you 80% inpatient hospital care, skilled nursing, home health care, and hospice. So Part A will come to you for free. There's only been a handful of people in my career that didn't pay in enough quarters that couldn't qualify for Part A. For people that don't qualify for A due to the quarters they work, they can pay for A, but it is a rarity. But some people do have to pay for A, but most of the time it is free, and it will cover 80% hospital care. Part B. Medicare Part B benefits. This will also cover 80%, but it's outside the institution of the hospital. So that will go against your primary doctor, diagnostic tests, home health care, outpatient services, even some outpatient surgeries, emergency room, partial hospitalizations will go against Part B benefits, as well as durable medical equipment. 80%. So you've got the A, you've got the B, and they are going to cover 80% of your medical expenses. But Part B is the one that's not free. And this is the one that when people are turning 65, I will tell you, are most surprised. A lot of people do not realize that Part B comes at a cost. And this is why pre-planning is so important. So the government, this chart is going to be reflecting 2023 costs for Medicare. But when you apply in 2023, the government looks back 2 years at your modified adjusted gross income to determine what your Part B premium is going to be. This took place starting in 2006, 2007. It used to be that everybody would pay the same amount, and that changed in those years. So now when people are looking to retire, this chart is very, very important to them. A lot of people will say to me, well, Tamme, Medicare is going to cost me more than it does to have group insurance. And that's where people really need to pay attention to this. Sometimes people will just think it's the average rate. They don't know that there's a sliding scale. And when I sit with clients, it's never my business to know what their finances are, but it's very much my business to make sure they know that this chart exists so then they can financially plan for Medicare. And this, once again, is just 80% of your Medicare expenses. This is before we even put insurance in addition to it. So this chart, every year, honestly, we don't usually get, we're in the middle of doing all our testing and preparing for 2024 as we speak, but they will not share the changes usually until closer to November, sometimes even in December, of what the rates for the following year will go up to. When I started doing this many, many years ago, it was $47 a month for Part B. And since then, here we are. It usually back in the day would go up every 3 to 4 years. We'd see this jump, but in the last 3 years, we've seen it go up every year. Actually, though, last year it went down a little bit. So last year, the basic rate was $171, and this year it's $164. So it did go down slightly. So that Part B premium, how would somebody pay that? So if somebody decides or is already taking Social Security income at 65 or upon retirement, they are going to deduct that premium right out of your Social Security check. So it's gone before you can even miss it. If you're not receiving Social Security income, you will then be billed quarterly, every 3 months. Now, some people will get real nervous, when they see that amount, especially if they're coming into Medicare already on a fixed income and qualifying for some subsidies. In Medicare, you can qualify for subsidies as well. So if you receive low-income subsidy, it's another term for it is called Medicare Savings Program. Sometimes it's automatically switched over for you in Medicare if you're already on Medicaid. But for somebody that might not already be on Medicaid when they're turning 65, we can actually do an application, or you can do an application through the state. And they might, once they receive your application and check your income, they might also pay for your Medicare premium. Some Medicare Advantage plans we've seen last year and this year, and even going into 2024, will help subsidize that Medicare premium. That has been a very big marketing thing that we see very often with a lot of these insurance companies out there on the commercials, in the mail, talking about, if you choose my plan, we're going to give you $65 against your Medicare premium. Or some people get $100 towards their Medicare premium. So there is plans out there. They're called Advantage plans, which we'll get to shortly, to understand what an Advantage plan is. But they also will give some compensation, not all plans, but some, towards that premium. Okay. So this slide, slide 13, I feel is probably, I've used this slide for however long I've done PowerPoint presentations, because the world of Medicare has so many options. And believe it or not, there's just over 60 options in Medicare to choose from today. And there's 19 different standalone drug plans to choose from today in Medicare. And how do we help somebody wean through this and understand it. I feel like this slide is very visual and it helps me. And I hope it helps you tonight. So out of these 60 some different choices, if we were to bring 60 plans to somebody in a meeting, it would help nobody. We could put a bunch of charts and compare copays and all the things, but that doesn't help anybody. Getting to the insurance piece and making insurance decisions when it's time, when you're ready to pick a plan is important. But understanding the fundamentals of Medicare, I find, is so important before you pick a plan. Because if you don't know what some of these terms mean, Medicare Advantage, Part C, Original Medicare, Supplement, how do you really make the right choice unless you really understand what you're choosing? So this slide, when I look at it, if I was to take 60 plans today, we would have to separate them in two different categories. The categories would be to the right, to my, when I'm looking at the screen to the right, Medicare Advantage option, or to the left, Medicare Supplement option. They are two different things. What is the difference? So your Medicare Advantage, another term for it is Part C. So we talked about the A, the B, there's D, drug plan. Is there a Part C? And there is. Part C, though, is a good old-fashioned term for HMO or PPO. But in 2006, we got fancy and we changed the world up a little bit with insurance and Medicare, and we created these Medicare Advantage products. Medicare Advantage products are designed to be less expensive. Reason being is Medicare, even though somebody has to pay for it, as we just saw, even though you have to go through the trouble of applying for it for people that do, when you choose a Medicare Advantage plan, Medicare is not your primary payer. The insurance company is. And these Medicare Advantage plans are designed to be an all-inclusive product. Medicare is still absolutely looking over it and overseeing the plan. You have to follow the rules and regulations of Medicare, but the insurance companies become primary payer. So you're getting medical and prescriptions all wrapped up into a little box with a bow. All right. So Medicare Advantage plans are designed to be less expensive in most cases. You have more of a copay structure and co-insurance, but it's one card that does everything. With a Medicare Advantage, my biggest advice for people when we're working together and we're trying to help them navigate choosing the most appropriate plan is when we look at these Advantage plans, the doctors that you see, the hospitals that you want to go to, the blood labs, if you travel, all those things we have to make sure, because the insurance company's primary, we have to make sure that your doctors have a contract with the plan that you like. Otherwise, if you go to a doctor and they're not in network, you might not be able to go there, or it may cost you more. So Advantage plans are wonderful. They're very affordable for most people. The cost is in addition to Medicare, even though Medicare is not your primary, but finding the right fit is the most important thing. It is never a one size fits all. Sometimes, because husbands and wives even have different meds, have different doctors, even our spouses cannot take the same plans. So it's very imperative when we're looking at insurance that you're going to have your best friends and your family members say, oh, choose my plan, it's the best. But for you, it might not be the right plan if you have doctors out of the area, or if you take a certain blood pressure medication or insulin. We have to look at everything. And so finding the right fit with Medicare Advantage is very crucial. There's ones that are more local. Those are the HMOs, Health Maintenance Organization is another term for them. And then there's plans called PPOs that stand for Participating Physician Organization. And those are a little bit more portable. So people that might have doctors out of state that they need to frequent, let's say Cleveland Clinic or Dana-Farber, they can do an Advantage plan, but you want to make sure that your doctor, if you're with a PPO, is in network with that plan as well. Advantage plans are the ones that will promote a lot of wellness. They give, your silver sneakers, the gym membership, a little bit of dental, nothing to get too excited about though. Dental is usually pretty basic. like cleanings and things. Some will give a little bit more monies towards, crowns and root canals, but in general, it's more of a basic dental product. You get eyeglasses. Some are giving acupuncture now. Some are delivering meals after you come out of a hospital. But more importantly, I tell people that, like, you want to choose the plan that suits you best with your prescriptions and your doctors, and all the other stuff is just fluff. It's great, but we want to really look at the advantage for the doctors and medications that you need. So that's one option that people have when they're turning 65 or going on Medicare. The other option to our left is another plan called a supplement, or a Medigap is another term for it. It means the same exact thing. Those plans are different than the Advantage because Medicare is your primary payer. So when somebody does a Medigap, or you hear somebody doing a Medigap or a supplement, or you go to the doctors, you're going to show that Medicare card that I showed in that previous slide. That is going to be primary payer. That's going to cover 80% of your hospital or medical expenses first, and then the remainder goes over to the supplement. There's a wide variety of companies, local and nationally, that offer supplements. The advantage to the supplement is they are very national. They are very local. So we don't really have issues with doctors. There was a time where people were worried that doctors wouldn't participate with Medicare. I've got to be honest, it's a rarity. I don't usually have issues with that. If somebody, has doctors at Cleveland Clinic or wants to get a second opinion, you can literally just pick up and go. You don't need a referral. So they're a very national plan. The key is that you want to make sure, if Medicare is primary, that the services that you're looking to do are coded and billed to Medicare correctly. Because if Medicare doesn't pay, then the insurance company will not pay. A supplement, because 80% is being covered by Medicare, and most of the remainder, 20%, outside of a few plans, is going over to the supplement. They are going to be more expensive because you have less in copay. So supplements traditionally are going to be pricier. And sadly, in the last 2 years, we've seen the supplemental premiums really increase because, they're very national. They cover a lot of, high cost services. And there's even some international benefits with them as well. The negative about the supplement, and it's not much a negative, but it is different, is that the drug plan, you have to do a standalone separate drug plan. You don't have to do a drug plan, but you'd be penalized 1% for every month you don't take one after 63 days of being new to Medicare. So you're pretty much put up against a wall. But with Medicare Part D, there is 19 choices that we can give to go along with your supplemental plan. And, we do all the research. So when clients come to me and they give me a list of meds, I have a special tool that I use for supplemental plans to look at the different drug plans available. So the drug plan, if you went to a supplement, you would really initially have 3 cards. You'd have your Medicare card, your Medigap or supplement card, and then you'd have a drug plan card. Where, once again, going back to the Advantage plans, that's all inclusive. Your Part D is embedded in the Advantage plans, the lower premium plans. Supplements traditionally do not give extra dental. Some plans will give a gym membership, some do not. They don't give a lot of the extra ancillary. They're more about the medical side of Medicare. Just some more little snippets in regards to Medicare supplement. They are provided by private health insurance companies. There is quite a few choices with Medicare supplemental companies. But the one thing that is the same is they're standardized. They all must offer the same benefits. So when you're shopping the market for supplements, the benefits are going to be the same from company to company, but what's different is the cost. So the cost will vary from company to company. Used with original Medicare only, so you must have Medicare Part A and Part B to have a Medicare supplement. Once again, Medicare pays primary and covers the major gaps in Medicare and Medicare approved charges. So once again, doctors and hospitals need to bill Medicare and code Medicare a specific way for those charges to be covered. All policies, once again, are standardized, which I just mentioned. Each policy will be identical from company to company, but the premium monthly costs may vary from company to company, except in Massachusetts, Minnesota, and Wisconsin. There's always been Medicare supplement plans with high deductibles. There is not all, but some Medicare supplements will offer high deductible plans where you have a lower premium for a supplement, but you have to meet a large deductible first. That has become pretty popular because people like the idea of the supplement, but don't like the premium. So people are now doing more high deductible supplements we've seen this year, just to have that protection if they were to get really sick and not have to really deal with copays. We do have high deductible Medicare supplements too, to keep costs lower. And we've seen more people run a little bit more towards those in the last year. A little bit more about Medicare Advantage plans. Going back with those lower premium plans, they're covered services and Medicare Advantage plans. They cover all Medicare services sponsored by private insurance companies. Medicare Advantage plans may also offer that extra coverage. For example, like I said before, gym membership, eyeglasses, dental, over-the-counter items. Matter of fact, a lot of them are doing these over-the-counter benefits where you'll get like $25 a quarter to get Tylenol, Tums, vitamins, things like that. So that's been a real big marketing thing with Advantage plans this year. People do love that. Drug coverage and Medicare Advantage plans. This is important. So you can't have a prescription drug plan through both Medicare Advantage plan and a standalone Medicare prescription drug plan. So let me repeat that. You can't have prescription drug coverage from a Medicare Advantage plan and then purchase also a standalone Part D drug plan. If you're in a Medicare Advantage plan that includes drug coverage, and then you join a standalone Medicare prescription plan because you feel like, oh, they might cover this one drug better, you will then be disenrolled from your Medicare Advantage plan, and then you'll only have original Medicare, which is only A and B, so you'd be responsible for 20%, and then a standalone drug plan. I actually, way back in 2006, when Part D was coming out, we saw a lot of people misinformed with that. They were in these Advantage plans. The Advantage plans might not have covered 2 drugs, but they liked the idea of the benefits that Advantage plan gave. They were not advised properly, and they thought, well, I'll just do the standalone drug plan now with it. They couldn't, and when they did that, it knocked their Advantage plan out, and then they only had Medicare and the standalone drug plan, which was devastating. So that's a big thing that we want to make sure people really understand. It's one or the other, can't do both. Some more rules around Medicare Advantage plans. Medicare pays a fixed amount for your care each month to the companies offering Medicare Advantage plans. These companies must follow rules set by Medicare. So what does that mean? That basically means a lot of people say, well, Tammy, I see this plan on TV and it's saying it's free. How can that be? Well, it's because the government is giving money, a fixed amount each month per person to have Medicare be on the back fence and that insurance company primary. And that insurance company is getting that monies to kind of keep the premiums lower and offer benefits. So instead of having Medicare first, the Advantage plans are financially induced to keep Medicare on the back fence, the insurance company primary, and that's how they're able to keep the premiums more affordable. However, each Medicare Advantage plan can charge different copays and out-of-pocket costs. Most companies have different rules for how you get services. For example, you may need a referral to see certain specialists, or you can only go to certain doctors, hospitals, or suppliers that contract with your plan for non-emergency and non-urgent cares. These rules can change each year. So right now, we are preparing for our annual enrollment period, which is going to start in October. And this time is a very important time that we, see all the benefits and the changes, and then we reach out to clients to see if they've had any health changes, if they've had any prescription changes, because if their plans change, we want to make sure that they're covered the same way that they've always been, that they're not all of a sudden going to have a med not on the formulary. So every year with Advantage plans, it's very important to keep in very good contact with our clients or our clients to check their plans, because we want to make sure that the doctors and hospitals that they've always went to are still in network with the plan. So a closer look at Part D. So Part D, whether it's involved in your plan under those Advantage plans or separate, if you're doing a supplement with a standalone Part D, the most important two concepts is the formulary. So what is a formulary? A formulary is a list of drugs that the insurance plan will cover. Medicare provides guidelines about the type of prescriptions to be covered, but not the specific drug. Each plan will have its own formulary, and Medicare has excluded some types of prescriptions, but some plans may include them as part of an enhanced formulary. So the key thing to take away from this slide is, once again, it is never a one size fits all. And I would say in my career, where I've seen things really change, and you folks, I'm sure, could all see this too, is the world of medications. They have evolved. They are keeping us alive longer, and they are fabulous. But with that, in my Medicare world, they are very expensive. So when we're looking at new people, and I'm working with new clients and even clients that have been with me for years, my number one question that always steers the ship with helping them decide on insurance is the meds that they take. Because if the meds are not covered under their formulary of the plan they love, then they're not going to be real happy when they go to the drugstore. So formularies are so important. We've had some adjustments over the last 2 years or 3 years now with insulin. There is some caps on specific insulin, not all. So insulin's a big thing, is looking and trying to get people on plans where it's capped. It's a thing. It's a big part of what I do every day. I specialize in the medication part. And simply because back before the year 2006, when people would come to me, if you can believe it, nationally, there was no drug coverage in the nation unless you were in group insurance or with low income. Medicaid would cover it. So back when I was starting, when people would come to me and they would be retiring and they came to me with a laundry list of drugs, I'd either say to them, hey, are you really going to retire? Or we would have to run and look at every single pharmacy and call doctors and try to do things in very creative ways to get prescriptions covered. So the world has evolved. It's a beautiful thing that we have Part D. I mean, for me, it was the biggest change in my career. It's the most important part of my job, is to make sure prescriptions are covered. So this slide is very, very important to me.
Amy, a quick
Yes.
question came in. Somebody asked, do any of the plans cover international travel? What's your experience with that? Is there coverage for people that travel internationally? And I don't know if you can answer this, but like typically, what do the premiums look like for that if it's additional?
So, okay. So as far as premiums go, I mean, it's kind of, I can't really, I apologize. I can't really touch on premiums, but I can tell you that there's some plans. So on the Medicare supplement side, the plans that are where Medicare is primary, certain plans will give foreign travel emergency. So if you were to take a plan that had it, what would happen is, if you were, let's say, in Ireland and you fell ill and you were in the hospital, there is a $250 deductible. And then you have a $50,000 lifetime reserve. So what does that mean? You're in Ireland, you fall ill, you're in the hospital. let's say you use $20,000 in that trip for that medical care, you will have then $30,000 left for the rest of your life. So if you stay in a supplement, every time you use that foreign travel emergency, it's going to debit down, but you are given it. I will say on the advantage side, certain companies, this is educational today, so I can't mention company names, but certain companies give you a little bit more grace out of the country than others. And usually they'll have a foreign travel emergency, like ER copay, roughly between $95 and $100. And then they might give an additional $10,000 towards a real foreign travel emergency. The only thing though, and I've seen this, that we do encourage, more importantly, people are definitely traveling to Europe and going all over more than ever because of COVID now. Everybody's getting out and about. I've had a lot of clients take these really cool trips, biking trips, and I'll say to them, listen, and they ask about foreign travel. I always encourage to take additional foreign travel insurance out, whether it's with your travel agent, your credit card company. I know AAA offers it, or you can go online and find a company for the reason of if somebody is, whether they're on a cruise ship or they're in a different country and they need to get to a close island or get home, air transfer is not covered under that foreign travel emergency. So to give you an example, I had a client years ago that was on a cruise ship. She fell very ill, and in the middle of the ocean, the closest island was Tahiti. So they had to airlift her from the cruise ship to Tahiti. When she got to Tahiti, everything was covered with the plan she had. She actually had a Medicare supplement. So that whole 2 weeks that she was in Tahiti healing, that was covered, but the airlift was $25,000. And that was probably 15 years ago. So I get this question a lot. I encourage, if you're going for longer periods of time, you never know, probably to take that travel insurance out. But some plans do give it, and they do give a decent amount, but airlift worries me. And I've seen a lot of people need the airlift. Does that help with that?
Seems like that answered the question. We'll see if any others come in, but
Okay.
so far so good.
Okay, so back to Part D. This slide is probably a slide that most everybody has heard about, the donut hole. The real term for it is the coverage gap, but the donut hole is the term that most people will recognize. Going into Medicare, I always tell my clients every day, the biggest difference coming off of group insurance or the marketplace is when we step into Medicare, the cost of meds traditionally for brand name medications will go up. And in Medicare, where we have to really advise and look is the government gives everybody, the best way to explain it is you figure you're given, like, let's say somebody's going into Medicare in October. The government's giving them initially $4,660 towards their medication. So depending on your plan, some plans have that first bill. You might have a deductible. The standard deductible you'll see on here is $505. That's the standard. Some plans, it's $200. Some don't have a deductible, but this is kind of the range that the insurance companies have to follow. But once you get past the deductible, that initial phase, that $4,660, that's important because every time you fill a med, every med that you fill, people think, oh, well, my little $2 copay is coming off the $4,660. I'm not worried about it, but it's not your little copay. It's the retail cost minus your little copay that debits down that $4,660. So for somebody that takes very little meds or a couple generics, no worries. They are always going to be probably for the entire year in the initial phase of the formula here. But some people, I have another 2 calls today about it. I have clients that are falling in now later in the year. They're falling into the coverage gap or the donut hole, meaning that they've just hit the government has said you've gotten to that $4,660. So now you're going into the other phase, which is the coverage gap phase. And in that phase, your brand name, more expensive meds will cost you 25% retail. Generics, you don't feel it as much, but the brand names, you feel it. And that's where, when we're sitting down with clients and we're assessing them, we go through this. And I have a formula that I can forecast, as long as no other drugs are added, which sometimes we don't know, but we can at least forecast initially when they come in, if they're going to fall into the donut hole and when. So in the donut hole, somebody is responsible to pay 25% of the retail cost of a brand name drug. Sometimes though, we have financial programs out there called low income subsidy that would cover in that point. Once again, certain insulins are capped, so you don't have to ever worry about falling in the donut hole with an insulin, but it's not all insulin, it's certain ones. And then we have Epic. Epic is a New York State pharmaceutical assistance program that some people can jump into to help cover them if they fall into the donut hole. So we really like to prepare people for that, but that is the reality. We do have this amount of money in Medicare that the government gives, and that's to everybody unless you're low income. Some people, as soon as they get into that donut hole, they might fall into the other category. So the other category, though, to get there, you have to be, it's the difference between 4,660 and 7,400. So when you're in the donut hole, it doesn't start again at $1 to get to 7,400. It's the difference. So it's about $2,500 that somebody, give or take, because it could be a little less than that between the relationship with the pharmacy and your drug plan negotiated rates. But you can get to the other side, which is catastrophic. And to get to the other side, you have to equal $7,400 in a year of medication costs. When you get to the other side, if you do, your meds go down very low to like a Medicaid level. So they go to 5%, 415 or 1035 the most. And then every January, it resets itself. Next year, it's getting a little bit better in 2024. And in 2025, apparently, it's really going to be different. I don't want to say for sure that the donut hole is going away, but there's going to be lower caps, and it's supposed to be helpful. My only concern with that, just because I've done this I feel like my whole life, is even though things might get better, the cost of meds tend to go up, right? So, so far we haven't been nor here nor there, but that is the thing about the Part D. If you ever wondered when people were talking about the donut hole, the exposure can be pretty great, 25% when you fall into it. Back in 2006, up until about 3 years ago, it was 50%. So it has went down some. So Part D, I said this very casually before. I'm going to touch back on it. Just like with Part B, if you don't take Part B by a certain period, you're penalized. And that is the same thing with Part D. So if somebody does not sign up for Part D, you may owe a late enrollment penalty if you go a continuous period of 63 days or after your initial enrollment period is over without a drug plan or credible prescription drug coverage. So basically, if somebody is new to Medicare and they're just like, you know what, I'm gonna just do Medicare, but I don't take any meds. I'm just not gonna do anything right now about the drug side. I'm not worried about it. Okay, that's your choice, but we want to make sure you know that after you get to that 63rd day without a drug plan, this 1% penalty will start, and that is indefinite. With Part D2, it's not like once you say you're not going to take it, you have to wait till our annual enrollment periods to sign up for it. So, it can be some time. It can be a penalty. And we don't want people to have to pay more for something that they didn't take right away. Medicare will penalize that 1% per month for every month that you do not have a Part D drug plan in place. And this penalty, once again, will be indefinite. Just to give you a case study, last year I had a gentleman, he called me, I remember it was in the fall, it was like in September, so it was pre-annual enrollment. It didn't start till October, so he had a couple months to wait, but he was on Medicare, and he called me and he said, I need a drug plan. And he was referred through a friend. And I said, okay. I said, let me understand your situation. Well, come to find out, he never had meds ever before. He'd been in Medicare already for 3 years with no drug coverage, and all of a sudden was diagnosed with something and was on 10 new prescriptions. He had to pay out of pocket for them. So sadly, I had to tell him, first of all, the bad news. I hate to be the bearer of bad news, but I really can't sign you up for a plan for a couple more months. And when I can, you're going to be penalized basically 36% in addition to the average premium for a Part D, depends on the plan, for all the months that you didn't have one. And he was not happy about it, so those are things, unfortunately, once again, we don't have a crystal ball. We never know where our health is going to go. And it's always good to take, even for my people that don't take meds, I encourage them to take a Part D, even just the cheapest one they can find. And there's some low premium ones out there just to protect them from the penalty and to protect them if all of a sudden they're given a med, even an antibiotic. Those antibiotics can be pretty expensive too. Okay. So Medicare versus group, timing is everything. So when somebody is on group insurance and they're approaching 65 or whatever it may be, they've been on, over 65 and now looking to retire, start this journey early, about 4 to 6 months before you anticipate enrolling in Medicare. And especially if you have an HSA, it has to be 6 months before you have to stop contribution. Contact me as soon as you're ready to retire or if you're thinking about retirement. What I will do is I will review your personal situation, daily medications, doctors, and your personal needs. We together will compare the plans offered in Medicare within your state and county, or if you're offered retired group insurance choices. We will research your daily needs as well as expected premiums, copays, etc. I will complete a Medicare review to allow you to plan better for your retirement and be better prepared for the transition financially. One of the things in my career that I do probably more than ever is for people now that have worked past 65 and they're in group insurance and they just don't, and it could be even a retired group plan, rates going up and premiums, just to open that educational door for them to look at Medicare and just to do a comparison. They might at the end of the day decide it's in their best interest financially to stay under that group or that, whatever it is. But to see Medicare and compare it is so important because a lot of people are surprised about what Medicare can give. But some people, we tell them it's better to stay under group if we run the numbers. So it's really important to do a very good comparison. In some circumstances, when making decisions on choosing Medicare, a spouse that is younger than 65 will play a big part in your Medicare decision. Always looking into your group option of COBRA, if offered for a younger spouse, or also comparing it to the New York State Marketplace plans is a very good idea to look at both. The Sable Insurance Agency will make sure we help you explore all your options so you can make the best informed decision for you and your whole family. A couple enrollment periods, I just kind of said casually, anybody in Medicare now or going into Medicare, every year between October 15th and December 7th in New York State, you can nationally, but in New York State specifically, you can switch your plans at any kind of plan, add a plan, change a plan during this annual enrollment period. So a lot of people, when they're going into Medicare, they're not sure if I'm stuck in this plan forever. No, we have the opportunity to make some changes during this time frame. And then again, between January 1st and March 31st of every year. Just some basic frequently asked questions that maybe you were just thinking about, maybe I can hit on now is, does Medicare offer dental coverage? Medicare itself, no. They will not cover dental care that you need primarily for the health of your teeth. But once again, some of those advantage plans or Part C, they will offer that basic dental coverage in some policies. Would a husband and wife be in a joint family plan, or are they considered to be individual plans once eligible for Medicare? A husband and wife must be on separate plans once enrolled in Medicare. There are no family plans for married couples in Medicare non-group. Some group plans have it, but non-group Medicare plans do not. And then lastly, is there any way to avoid that donut hole or coverage gap? If you qualify for extra help, I said like it's called low income subsidy, or in New York State, we offer the extra help with the state pharmaceutical assistance program called EPIC. Both of these are income driven, but they're pretty good with the income that is allowed. They're pretty fair. And then I'm just going to leave up my contact information here for anybody. I don't know. This is the end of the presentation. Thank you so much for staying with me and Mike tonight on this beautiful Buffalo summer evening. I know it's one of our rare beautiful nights. We've had so much rain. So thank you for all your time and attention. I'll stay on if anybody has more questions. And then certainly some of these questions may be more private. Or have more detail, you can text and then Mike will share that with me and I can reach out at a better time.
Yeah,
Thank
so
you, everybody.
yeah, great. Thanks so much, Tamme. Real quick, that text line again, 716-727-5047. I'll make sure I get your contact information over to Tamme. Other than that, I think we'll leave it right there, and everybody have a wonderful evening, and thank you for attending. Thanks to Tamme. Take care.